Now to this now, one of our leading stories today, Health Minister Dr Aaron Motsoaledi briefed the media on findings of an SIU probe into claims against health departments across the country. Let's get some reaction on this as we're joined by Zwelinzima Vavi, who's the General Secretary of SAFTU. Mr. Vavi, thank you so much for joining us this evening. I guess, firstly, SAFTU's reaction to hearing this, even though it's not really new news, but hearing that there's billions of rands that have been siphoned.
It's unbelievable. It's our country. We don't know where to run to. You go to the lawyers to help you when you have an injury. They themselves have tended to be crooks, some of them. You get injured whilst you're going to work or about doing your own business. You go to them, they're asking for 25–30% of the cut after helping you. You go anywhere to the police stations if you, according to the citizens of Umtata, you seeking refugee, you are being taken for a ride by people who are demanding money on you when you are doing your own businesses as a butcherman or doctor or anything, even when you're selling a magwinya. These guys are all over, they're asking for you. This is anywhere else, it will shock people to death. But here in South Africa, we're not shocked at all that lawyers are scheming and they are looting and they are literally taking advantage of the system, left, right, and center. And well done to the minister and well done to the SIU for doing their part in exposing the scam led by the lawyers and submitting claim after claim. In one instance, according to the briefing today, one lawyer over just a period of 5 years submitted 44 fraudulent claims on the Department of Health, costing millions. One has been deregistered in the Western Cape, emerges in Gauteng, continues from where he left from the Western Cape. It's scandalous. Well done to these guys who are exposing them.
And also, Mr. Vavi, why I started off by saying, even though it's not necessarily new, and this case that you speak of that Dr. Motsoaledi rightfully named and shamed was the case of Zuko. He is not new to the media as well. I have personally covered that case and spoken to some of his victims as well. But what the problem has been, particularly in this case that I can speak to, is that he's been able to get away with it. The SIU launched a probe into him many years ago already, but then we've got a regulator like the Legal Practice Council that also took a very long time to take action against him, and he just continued. And in a country like South Africa, where our health system is really going through what many would call a crisis, we need each and every single penny. Now, he was able to get hundreds of millions of rands, and though while it was re-exposed today, those victims still remain without the monies that he got.
Exactly. What is more scandalous in this case, exposed by the Minister of Health and the SIU, is that these crooked lawyers are working with officials of the department to milk the state, to milk the taxpayer, and to take us backward when we're supposed to be moving forward and progressing in terms of addressing the health crisis in our system and in our society. It's absolutely scandalous that you have these officials all over, always taking advantage of the system. Look at the newspaper running a headline yesterday that says, since the death of Diogaran, the celebrated whistleblower who was killed when he was exposing the rot in the Tembisa hospital. And according to that report, it says that since she died, we have lost a further 2 billion rands, and on again tender fraud, management mismanaging, and in our country, by the way, We are always going down when it comes to ratings of the indexes of corruption all over the world. The Transparency International is rating us very low, and we continue to climb down, year in, year out. Our private sector is being rated first and the second worst corrupt in the whole world. Some years we become number one, other years number two, number three, and after India and Chinese crooks, and according to the PwC. Now, this is just so bad for a society which have an unemployment rate of 42%, now 43%, if you use the expanded definition of unemployment, or an unemployment rate of about 33% if you use the narrow definition. 8.4 million of our young people are roaming the streets unemployed, not in any kind of employment, education, and training. And whilst we're looking at that, we have crime levels, and at that maim 84 people every night or every day in our streets. Now we have extortionists all over the country, not Gqeberha, Tata, or Cape Town, all over Pretoria, Durban, everywhere. You then have the construction mafia, and every indication point to the fact that the state is simply failing to defend or to perform its most basic functions to protect us from the crooks. And some crooks are wearing ties, and they wearing sharp shoes, and they have helicopters and private jets. They are milking the state billions of rands. Some crooks are wearing tekkies, and the lumpen working class elements, they also taking advantage of the laxity in the system, and they are killing us. They're raping, they are extorting money from unsuspecting citizens.
Yeah, Mr. Vavi, while I still have you on this as well, because, you know, I think we could really talk for a very long time about just the plethora of the problems when it comes to corruption as well. But just in the interest of time, before I let you go, I just really wanted to ask you on a solution for this, because when we think about it here, you know, we are told that the SIU started probing this investigation into provincial health departments as far back as 2015 already. And as you're mentioning in the case of Babita Diokra and the whistleblower as well, as time goes by, there's more damage that is done. What should we be doing at this point when we also have, in instances like this one, a regulator that's not acting quick enough, but also allegations that, you know, staff, hospital staff as well, could be involved?
We ought to go back to the movement that we were in 1980 up to 1994. We were a mass movement of mass mobilization. We had street committees, area committees. We have strong civic associations and trade unions. We have strong watchdog formations, left, right, and center. It comes down to one thing: active citizenship. It is the people who are bribing. It is the people who are reporting their kids coming out of hospitals, and it is the people who know that a lawyer have submitted so many claims of dead people. It is our people who know where the crooks are staying and who is extorting money from them. If we could only go back to the 1980s, rebuild the movement, street by street, area by area, township to rural area by rural area, until we have the entire society mobilized. If we do not reach that level of mobilization again, we are dead in the water, because it is a small minority, basically, of crooked doctors in this particular case, of police who are working with the crooks, of public health officials working with these crooked lawyers, and of people who are cooperating and in order to cut corners. If we could mobilize society again, this is our call as SAFTU. Let's go back to the 1980s and remobilize society, so that all of us working with the honest police stations and honest public sector officials to root out the corrupt elements in all departments of the state, not just in the public or in the healthcare, but everywhere else, to make sure that we reclaim our freedoms. If we don't reclaim our freedom, it is going everywhere.
And just finally, Mr. Vavi, you know, a big talking point when it comes to health as well is the NHI bill. Lots of mixed reaction when it comes to it, and a lot of people and experts saying, look, in principle it makes sense, but let's get our healthcare system right. Now, if we have cases such as this going on across the board in, you know, in all our provinces, but particularly the Eastern Cape and Gauteng that have been flagged, how are we ever going to be near that NHI dream?
The NHI is not going to be panacea. It is not going to resolve the corruption of the public sector officials working in tandem with the private sector crooks. It is not going to on its own fix the problem of understaffing. It is not going to solve the problem of massive development in terms of our infrastructure. It is not going to solve many problems. It requires, again, an active government that is going to accept that national health insurance first means employing enough people to help us when we're in clinics and public hospitals, rooting out the corrupt elements, making sure that the infrastructure development is up to scratch and can meet the demands of our time, and making sure that the health efficiency reaches higher levels than what we are experiencing now. Only when all of that happens will we begin to say, indeed, there is a national health insurance that is beginning to solve the problems at hand.
Mr. Vavi, thank you so much for joining us this evening and sharing your reactions too. That was Zwelinzima Vavi, who is the General Secretary of SAFTU.